Dr. Davidhizar, I want to ask you, there's a lots of talk about, colon cancer or any kind of problems in and with the colon becoming much and much more problematic. Is that true? Do you shed some light on that whole things about our intestines and stuff like that?
Well, colon cancer is becoming more common, unfortunately. And the problem with colon cancer is you don't really have any warning signs until it's pretty far advanced. So everybody should be watching their stools, make sure there's no blood in it. That's one of the first signs of trouble. And everybody should have their screening tests, their colonoscopies. At age 50, they should have their first one. If that's all completely normal, then usually wait 8 to 10 years. So it's not like you have to have them very often, because we know that cancer grows very slowly in the colon. But if you don't do anything about it, eventually it becomes a very serious problem, with spreads usually the liver first and other organs as well. So the key is to find it before it causes a lot of trouble. We think more and more the problem with colon cancer is the toxins that we have put in our body in the forms of food and other things. So I try to encourage my patients to stay on a really high fiber diet. We have some natural fibers I recommend that really help detoxify their body, and it helps make sure that they're regular. We don't want to be able to be constipated. That causes more problems with it as well. So if you stay regular, eat a good diet, and do screening regularly, you should be able to prevent colon cancer from ever giving you a problem. There's been some new data that came out recently that showed that people that take a baby aspirin a day, their incidence of colon cancer is much less as well. So I always recommend my patients do that. We should all be doing that anyway after the age of 50, but it also has benefits not just for your heart, but also for your colon that we've discovered recently. So anything you can do to help prevent problems, I'm always trying to encourage my patients to do. So those are just a few of the things that we recommend.
So you said that we should be taking a baby aspirin after the age of 50 anyway. Is that referring to the heart attack kind of thing, or to the to make the blood to thin the blood and make it flowing?
It is. That's been shown to be very effective in preventing some problems with the heart.
Okay. All right. So basically, colon cancer, yes, it's on the rise. So let's just assume a person at the age of 50, 58 anyway, whenever he does his first testing and something is detected, can it usually be fixed?
Yes, especially if they find it with a colonoscopy. If he comes in and has symptoms, abdominal pain, those sort of things, then sometimes it's a little late. But if we find it as just a screening exam, we know that most of the cancers come from polyps. It takes a polyp about 8 to 10 years to become malignant in the colon. So if you're having your exam done every 8 to 10 years. Now, if you find a polyp in one of those exams, then we move up the frequency of the screening tests. But if they're always negative, if you have one done in 8 to 10 years apart, that should prevent you from having any problems with colon cancer.
All right. Wonderful. So it's not, again, if we take regular examination, check things out, then we really don't have to live in fear about it. We'll find it, we usually can still fix it.
Yeah, preventive medicine is always the best treatment.
An ounce of cure is worth a pound of whatever. How does that go? An ounce of prevention is worth a pound of cure.
Pound of cure, yep.
Well, all right. Thank you very much, Dr. Davidhizar.
You're welcome.